The needle exchange program was created to reduce the risks of diseases such as hepatitis and AIDS. If you had the several $100,000 the county currently spends annually on needle exchange, and were asked how best to spend it on drug abusers, yielding the greatest positive impact on public health and public safety, how would you spend it? We'll start with Mr. Welly.
Okay. Well, I think we need to bring back the drug and the gang units because there's a lot of talk about the needle exchange, and it's basically a health issue, not a law enforcement issue. And we seem to be bogged down in treating the symptom rather than the root causes. And two of the largest root causes are gang problems because the gangs bring heroin and methamphetamine by the ton right now into the county. With the drastic downsizing of the gang units and the drug enforcement units, we're seeing so much more drug activity, and drugs have gotten much cheaper than they used to be. So I would put a lot more people in those units, use the money to put more people, more officers from multi-agencies around the county in those units, beef them up, and try to address those serious problems. Also, we could examine maybe having some sort of a mental health unit in conjunction with mental health services. That could have been done with this grant that they're doing out of the jail farm, because it specifically allowed for that in terms of the grant. But I'd like to see us working in concert with mental health, because drugs, gangs, mental illness, transient addicts are all intertwined, and civil homelessness is also an associated issue. We have to address this, and we ignore homelessness because it's sort of politically incorrect, and people want to keep sanitary weird, but at the same time, we can't just ignore it and think it's going away or that it doesn't exist. So nothing realistic has been done in these areas for a long time. There's a lot of excuses. There's a lot of talk about how we treat the symptoms, but no one's actually doing anything concrete. Why does Carmel have? Why don't they have this problem? Why doesn't Los Gatos have this problem? Why don't other communities have this problem? What we need to do is look at what they're doing right, apparently, because they don't have these problems, and start emulating some of the things that they do. We need to be sensitive to the homeless, but we also need to be sensitive to the citizens of the community who are victimized by transient drug users. And I think we just need to be realistic. We need to be scientific. There's very little scientific evidence on the needle exchange program, whether it's working or not. Some of it's positive. We can do a couple of things to tweak that, maybe one-to-one needle exchange and marking the needles. And I'm not saying I'm in favor of completely doing away with it, but we need to think about other ways of dealing with the root problems. Thank you.
Thank you. Mr. Pursley.
Needle exchange comes with so many problems. First off, we have to deal with the public safety issue. That's people stepping on needles, finding discarded needles in their yard, finding needles in parks and playgrounds. We created that problem by supplying so many needles to people we're trying to help. It's a compound issue. First thing we have to look at, if we have enough money and we're able to disseminate that money throughout the program as we see fit as a sheriff's office, the first thing I would do is get rid of the fixed syringes, and we would go to retractable syringes. A one-for-one exchange of retractable syringes. So, if the users see fit to throw a needle to the ground, your children or your pets will not step on these things. That's the first problem. Get rid of the public safety
Of diseases such as hepatitis and AIDS, if you had the several $100,000 the county currently spends annually on needle exchange, and were asked how best to spend it on drug abusers, yielding the greatest positive impact on public health and safety, how would you spend it?
Well, when you're talking about the vast numbers of needle users in Santa Cruz County, at one point in the 90s there was about 5,000 identified IV drug users in Santa Cruz County. $200,000 or $300,000 is really a small amount of money, especially when you're talking about the transfer of a communicable disease like AIDS or HIV, or AIDS or hepatitis C. The clinic was taken, the needle exchange program, the county adopted it from a nonprofit called SOS that was operating in the city of Santa Cruz. And so the county took it over to make sure that the exchange rates were down, that there was a much better control over the number of needles being disseminated to the community. And it's turned into a real difficult thing for the Emmeline Grant Street neighborhood because a majority of the needle exchange takes place out of the Emmeline complex. I've sat on a number of advisory committees, including the Syringe Services Program Advisory Committee, and some things that are being done in order to alleviate the problem in the Emmeline neighborhood is to restrict hours of operation, restrict days of operation, have a mobile exchange to other medical complexes throughout the county so that just that one neighborhood is just not getting inundated with IV drug users. Some other things that we need to look at. One, treatment. Treatment is huge, but treatment is extremely expensive. $300,000 to treat that vast of a number is just a drop in the bucket. But we need to look at more treatment. We need to look at beefing up the methadone clinic as far as trying to replace the heroin and the needle use with methadone so that they're not injecting, they're just taking methadone in the liquid form. The other thing is there's a drug out there that's an experimental drug being used in the jail and a little bit in the county called Vivitrol. And it's a one-time injection a month drug. It does the same thing as methadone and it's had some very good successes. So I think we really need to look at using our Medi-Cal and Medicare dollars at using those type of replacement drugs so that so that we can get away from the needle use if a person is amenable to treatment and using replacement drugs. The other thing we have to look at is how are we attacking the problem? There's two thoughts to drug enforcement. There's the demand reduction side in the schools and early intervention, and there's the supply reduction side of the enforcement side. We've tried to arrest our way out of this problem. We've tried to investigate as many drug cases as we can. For as many drug dealers as we arrest, for as many drug users as we arrest, more come in right behind them. We know that the demand reduction is what is going to work in the long term. We've got to get into schools, we've got to have early intervention, we have to have education so that our youngsters don't start that cycle of drug abuse and addiction.